And this. We are at Groote Schuur Hospital in the Mother City, where there is great excitement this morning. Behind me is a massive machine, and it's called the Da Vinci Xi 4th generation robot, and it will be used in surgery. Now, this is the first on the continent in a public hospital setup. But to talk to us a little bit more, I'm going to call in the experts, because this is way beyond me. We're going to speak to Dr. Samkele Salokazana, and he's the robotic surgery coordinator at Groote Schuur Hospital. Good morning, Doctor. Thank you very much for joining us. Doctor, we saw you a little bit earlier working the robot. Why are you so excited about this, and why should we be?
Right, thank you so much. Good morning. So, as you clearly mentioned earlier, the robot has actually been around, in the world, which has been used in Europe and America, and it's actually been the standard of care for major surgery, pelvic surgery, including radical prostatectomies in urology. And as you mentioned, it's actually the first, state robot in the country. We do have a few robots in the private sector, and I think they've been around since 2018. We're really most excited to have the state-of-the-art 4th generation XI robot, which is going to be a big tool, in our hands, in improving our laparoscopic skills and the outcomes in terms of operating in patients with sort of deep pelvic surgery, which may include urology, in doing radical prostatectomies, and other disciplines would include urogynecology. It will also include disciplines like general surgery, bariatrics, cardiothoracics, colorectals. We're quite really excited getting into this adventure with our state patients in Cape Town.
Doctor, you mentioned laparoscopy. Exactly. That's why I called you in to talk to us about this. What does that mean for the layman and minimally invasive surgery? Just explain that to us.
So minimally invasive surgery essentially is in layman's terms, keyhole surgery, where we make a few cuts on the abdomen, depending on where you're doing the surgery. If you're doing abdominal surgery, a few cuts in the abdomen. Using fine instruments, conventional minimal invasive would be laparoscopic surgery. But now we're moving forward to doing robotic surgery, which is essentially, it's actually called robotic assisted laparoscopic surgery, which offers, far better, operative, exposure, and looking at the benefits of the surgeon, which included a three-dimensional view. Also, magnification is quite significant, 10 times. A good range and free range of movements when one operates in deep ends, like in the pelvis. And also, we know very well that there's very good data to support good outcomes for patients because it's minimally invasive. There's other outcomes that people have looked at. Less blood loss. Minimal tissue trauma, which translates to minimal inflammation, less pain. And less hospital stay for patients, which is actually a big thing, if you look at outcomes for patients.
And Doctor, why are you so excited? You just said that robotic surgery has been around for a very long time, and it's been around in the public sector for quite some time. Why are you so excited about this robot?
So, it's never been in the public sector. We're the first unit, as I mentioned earlier. It's been around in the private sector. We actually quite excited that, doing minimal invasive surgery it will be easier in the hands of a robot with a good range of movement. And the fact that obviously we're getting the state-of-the-art new 4th generation Da Vinci Xi robot. Probably most importantly, we really are quite excited about the outcomes, the endpoints, for our patients. That, as I mentioned, with better outcomes, functional, and the clinical outcomes, which may actually help the patients very well.
Doctor, and we're seeing arms moving there behind you. Can you just briefly explain to us what it's doing? Yeah. And what is this simulating?
Yeah. So essentially, we've got different components of the robot. We've got the surgeon console, and we've got the patient cart, which basically has the arms, and we have the vision cart. So the surgeon operates on the console, and obviously controlling the arms of the robot, which different instruments. One of the instruments then would include camera for vision, and the ports are placed depending on what surgery you're doing, and how your patient cart would be located would depend on the surgery you're doing. If you're doing, which is something called docking, which depends on what operation you're doing. So, and then the few small incisions that you make are basically for port placement, and then you introduce the instruments depending on the surgery you're doing. You can have scissors, you can have bipolar instruments which will do different things in the abdomen. And so the console is actually the main driver of this whole machine, where the surgeon essentially moves instruments. It's got the ability to move the camera around on the surgeon's console and all the instruments, and can also interchange using sort of buttons and on the surgeon console to try and manipulate the instruments while doing the surgery.
Let me just step out of the shot for a moment and ask my colleague Clinton Cerf to just show the console that Dr. Salukazana is talking about. Doctor, you were working on it a little bit earlier.
Yes.
What does it feel like to sit there and control it?
It's actually, it's a better form of operating for a surgeon, because, the ergonomics are quite amazing. You're sitting comfortably, on a nice chair, and essentially in a relaxed position, you can be able to manipulate instruments, and you can play around, like I said earlier, where you can sort of switch and change between the instruments at your own comfort. You don't necessarily have to be fully scrubbed for the procedure. You can just wear your normal scrub without essentially scrubbing, because it's sort of essentially a sterile sort of environment on the other end. But obviously bearing in mind that the patient cart is the most sterile environment that you should not be touching, unless initially when you're starting the procedure you may have to scrub and then sort of make the small incisions for the ports. But it's really an amazing sort of piece of equipment. More especially the hand movement. Essentially, you can almost do like 360-degree movement on the hand, which you don't get with conventional laparoscopy. And that's the art in robotic surgery. Better vision, magnification, clear delineation of the anatomy, and easier dissection, and with a good range of movement and vision.
And then just lastly, Doctor, does this mean you'll be able to help more patients within the public sector?
Yeah, so if when starting such a program, then we, as the unit, we have a robotics committee which is in line with discussions management. We're going to run a robotics program, which essentially means we'll do over and above what we're offering to patients. So we'll have a new extended theater time, which is going to be from Monday to Thursday, where essentially we'll be doing robotic cases Monday to Thursday. So it is essentially going to extend the volume of cases we do and offering service to our patient. And obviously state-of-the-art equal access to robotic surgery, which currently is only offered in the private sector. So it's really going to come with a lot, and like I said, most importantly, it's going to be benefit to patients. And from our point of view, a bit of a learning curve, but it's not as bad as a conventional laparoscopy. And we're going to create data, in the future, so we can show results, and the relevance of actual robotic surgery in the country, which we're quite excited about.
Wonderful. Thank you so very, very much. I know you're a very busy man. Dr. Samkele Salukazana is heading up the robotic surgery program here at the Groote Schuur Hospital, telling us why he's so excited and demonstrating how this wonderful piece of equipment works. And of course, they're very excited here. More patients could be helped. It's less invasive. The healing time is shorter. So it's a big moment for Groote Schuur Hospital and for the public sector healthcare within the Western Cape.